His name was Thomas Eric Duncan. He was 42 years old, a father, a devoted son. He was also unknowingly carrying one of the deadliest viruses on Earth. By the time his plane touched down in Dallas, Texas, Ebola had already begun its work inside his body. He didn't know it yet. Neither did anyone else. But the clock was ticking toward one of the most terrifying medical crises America had ever faced. Thomas had been living in West Africa, helping to support his family back home. When his pregnant girlfriend fell ill with what seemed like malaria, he did what any loving partner would do. He cared for her. He held her hand. He comforted her as her fever spiked. He had no idea that Ebola was flowing through her blood. No idea that every touch, every moment of compassion, was signing his own death sentence. She died on September 8th. Thomas buried her, grieved her, and 4 days later, boarded a plane to America. He was running a fever, but he didn't report it. He had no symptoms of Ebola yet, or so he thought. The virus was still in its silent phase, multiplying quietly in his organs, waiting. When Thomas arrived at Texas Health Presbyterian Hospital in Dallas on September 28th, he walked in complaining of a fever and body aches. The doctors saw a man who had recently traveled. They asked about malaria. They tested him for common infections. Nobody asked about Ebola. Nobody even suspected it. Why would they? Ebola was in Africa. This was Dallas, Texas. It couldn't happen here. He was sent home with antibiotics and told to rest. For the next few days, Thomas grew sicker. His fever climbed. His body began to betray him. He returned to the hospital on September 30th, and this time, something was different. His condition had deteriorated drastically. The doctors noticed he was vomiting. His abdomen was in agony. There was talk of appendicitis, of surgery. But still, nobody thought Ebola. Not in Dallas. What doctors discovered next shocked the medical world. On October 1st, Thomas Eric Duncan tested positive for Ebola virus. It was the moment everything changed. Within hours, the hospital that had turned him away days earlier transformed into a fortress. Entire floors were sealed. Staff members who had touched him, spoken to him, worked near him, they began a terrifying countdown. Each one of them now lived under the shadow of a virus that killed up to 90% of its victims. The fear wasn't just medical. It was existential. But Thomas's case exposed something far darker than a single infection. It revealed the shocking truth. American hospitals had no real plan for Ebola. No protocols. No training. The CDC had spent decades warning that a pandemic was coming, but when the moment arrived, nobody was ready. 2 nurses who had cared for Thomas, dedicated healthcare workers, who had done everything right, or so they thought, contracted Ebola themselves. Nina Pham and Amber Joy Vinson became the faces of a broken system. They had worn protective equipment. They had followed what they believed were the correct procedures. And they had still gotten sick. The message was chilling. Even the best efforts might not be enough. The nation watched in horror as news anchors reported each development. Schools held emergency meetings. People stopped flying. The grocery store became a place of paranoia. Every fever was suspect. Every cough could be Ebola. Social media exploded with fear, with accusations, with demands for answers nobody could give. Thomas lay isolated in his hospital room, fully conscious, aware of his deteriorating condition, knowing that he was becoming the face of America's greatest medical nightmare. His family couldn't hold him. The doctors couldn't save him. By October 8th, his organs were failing. His blood wouldn't clot. His body was shutting down from the inside. He died on October 8th, 2014. Thomas Eric Duncan became the first person to die of Ebola on American soil. But his death wasn't the end of the story. It was a revelation. In the days and weeks that followed, investigations uncovered a trail of human error, institutional failure, and terrifying gaps in America's pandemic preparedness. Hospital workers had been exposed. A second wave of infections was a real possibility. The CDC faced angry questions from Congress. How could this happen? How could a deadly virus slip through our defenses? Why weren't hospitals trained? Why did it take a man's death to expose these failures? The two nurses who contracted Ebola survived, but their survival felt less like triumph and more like luck, and luck wasn't a strategy. Their recovery only deepened the mystery. Why had they lived when Thomas had died? What variables could have changed his outcome? The hard truth was that Thomas had arrived at a hospital unprepared, unaware, and untrained. He had become a test case for a system that was fundamentally broken. In the months that followed, the Ebola crisis in West Africa would kill over 11,000 people. But in America, something different happened. Thomas Eric Duncan's death became a warning. It was proof that distance doesn't protect us, that borders don't stop viruses, that preparation and paranoia are often the only defense we have against the invisible. Today, his name lives in medical history as Patient Zero, the man who showed us how fragile our safety really is. Because Thomas didn't die just from a virus. He died because we weren't ready. And the terrifying question that haunts us still is simple. When the next one comes, will we be any better prepared?